senior consultant in internal medicine and diabetes. I'm practicing for the last 15 years diabetes as well as various lifestyle problems. Of late, we are finding it extremely difficult to manage lifestyle illness. In lifestyle illness, the major part is nowadays contributed by stress. So stress has got a major role, and there are various scientific evidence to suggest the link between stress and medical illnesses, especially the lifestyle illness. But in tackling lifestyle illnesses, apart from lifestyle modification, thinking about or doing various yoga can definitely help manage the lifestyle illnesses better. So in this way, if you think about yoga, yoga is not any fancy postures or any fancy exercise. It's about synchronizing mind with breath and various physical postures. So these three components has to be synchronized. Some people do power yoga, some people do slow yoga, but the essence is we all should be able to synchronize the breath, the mind, as well as physical postures. So by doing this, we have sufficient scientific data to say that it helps relieve our stress. It can help you reduce the blood pressure. It can help you reduce blood glucose levels. So overall improvement in many clinical conditions can be achieved by practicing regularly yoga. So with this thing in mind and with this introduction, I am going to explain about three various asanas which I routinely explain or advise to many of my patients with good benefits. One is Tadasana. Tadasana means the mountain pose. This is more of like a standing posture, but this definitely helps in relieving the stress. Not only that, this helps in increasing the insulin sensitivity, as well as this posture helps in reducing the hypertension, or if the blood pressure is high, it helps us to reduce it. So more about this posture will be explained by our yoga instructor. And it's easy to do Tadasana, and once if you're doing it regularly, see that you are breathing in a very comfortable and in a slow manner, and also synchronizing mind, that is with a wandering mind, when you are not at the present or when you are not at the moment, then probably I personally feel that the benefit of yoga will not be there. So slow breathing, concentrating on the breathing and doing the posture with the present mind or the mind at the moment, that can help you with a good success with regard to yoga, especially this posture. Second one, which I want to introduce to you all. Introduction means it's been there for centuries, it's been there for thousands of years. That is the Vakrasana. Vakrasana means it's about its gentle half spinal twist.
Vakrasana, keep your both hands forward, parallel to the ground. Touch your both the thumbs.
Turn your right side very gently, slowly, gently. Focus on your gaze on your right hand, touching your left hand to the shoulder. It is gentle vakra, twisting to the lower back. Inhale very gently come in the center. Again, both the hands parallel to each other, both the thumb touching each other.
So this is supposed to help regulate the blood glucose levels and also as I said before, helps to regulate stress, mood, and even the posture. Basically, this is in a seated position. This is done in a seated position where you twist your body, twist your side, twist your spine to both sides, and gently breathe in and out. So this is Vakrasana. The third posture, which I want most of the diabetic patients to consider training themselves, is Eka Padasana. So the name suggests that it's standing on single leg, but it may be many people may find it very difficult to do it initially, because balancing your whole body weight in a leg, because balancing your whole body weight in a single leg may be difficult initially. But on practicing, you all will be able to do it over a period of 4 to 6 weeks of time. So by this, you are activating your leg muscles, your core muscles, and various other muscles, as well as it helps retain your balance. And also it can help prevent the progression of neuropathy, and also this helps improves your insulin sensitivity, reduces the stress. By reducing the stress, it reduces the blood pressure, and overall it helps your cardiac health. So lifestyle modification is important, medication is important, but in this modern life, when you are stressed much with your job or with your financial situations and with the modern life stresses, yoga plays a major role in reducing the stress, as well as the prevention, as well as preventing the progression of many of the medical illnesses, especially heart diseases and diabetes. So try practicing yoga. And again, I stress the point that all these postures can be tried, but under the guidance of a yoga instructor, until you are confident of doing it in a very synchronized way, with keeping your mind balanced, keeping your breath balanced, and keeping your postures balanced. Thank you very much.